Welcome, everyone, to the ACL Athlete podcast. This is the podcast where we talk about everything related to the ACL, whether that's the injury itself, the rehab process, return to sport, and more. I'm your host, Dr. Ravi Patel, performance physical therapist and coach. Between myself and fellow guests and experts, you'll learn through the lens of the patient, the healthcare professional, and the coach. The goal of this podcast is to equip you, the athlete, with the education to make the best informed decision about your care and your ACL journey. Thanks for joining. Now let's dive into today's episode. What is up, team? And welcome back to another episode on the ACL Athlete podcast. So at this point, I've talked with thousands of ACLers over the years, and one thing that I always ask in conversations, especially with ACLers, when they're looking to work with our team, whether they are dealing with just some problems going on, we dive into some of the details. And so one of the things I always ask is about the surgeon and their physical therapist that they're working with. And oftentimes when they talk about the surgeon, there tends to be a little bit more effort in finding this professional. There's almost like this level of like, I'm proud that I found this particular professional based on their experience or maybe the particular achievements they have, associations. And with this, they typically have maybe reached out to other people who have had ACL injuries, maybe medical professionals that they know. There tends to be just a bit more effort, if you will, in finding this professional. They've looked at those online reviews, they've consulted multiple surgeons, maybe, and they've done their homework. They are noted potentially as the best surgeon in the city. I hear this a lot. I hear they're the go-to surgeon for this particular procedure for ACL. They're quote unquote the pro team surgeon for this particular pro team local to you. And they do all the pro athletes around, right? Or they did X athletes ACL surgery. And don't get me wrong, I was even a sucker for this. I went to a surgeon who specifically was associated in the town that I was in for college. And that surgeon for my second ACL did the UJ football team surgeries specifically for their ACLs. And guess what? In hindsight, his technique for getting my hamstring graft was actually not really great. When I look at all the different ways to harvest hamstring grafts, now that I am beyond that, I'm beyond my undergrad, I've done, my physical therapy education, and I've dove into ACL world. So I'm very familiar with this, especially because I can compare two different ACLs with the same graft type, but two different surgeons. And so I had my high school ACL injury, had a graft that was taken from my hamstring. I don't have really any donor site related pain, if you will. I do have some weakness in my hamstring that can kind of come and go. But then with my second one, I had a hamstring graft, but the incision point is not super solid. They actually went in where the crease of my inner knee is. And so that created some scar tissue, that created some hamstring issues that honestly I still ebb and flow with, that I notice even today, right? Now, does it influence the performance of my hamstrings? Still kind of same as the other side of like the weakness can kind of ebb and flow. I have to make sure I keep strengthening my hamstrings. It's easier to strain, if you will, because I am essentially lacking a muscle group because that tendon is taken. So that muscle is not just regenerated by nature. It actually tends to atrophy. It may attach to other muscle groups. But with that said, with a hamstring graft, it's still not fully understood what happens, but a lot of times it atrophies and goes away. The procedure on the second one I just notice it just kind of feels funny. Sometimes it makes me hesitate with certain movements when I'm doing strength work. And so with that said, this was the best surgeon, right? This was associated with the best athletes, the top tier team, D1 college. And I would say that the technique that was utilized was not very optimal. And this is my own personal opinion. That was maybe his training, maybe it was just a one-off thing. But in my opinion, based on this and knowing this space, I think that wasn't great. But I thought he was the best, right? So while there may be some associations with big names, quote unquote, the best needs to still clearly be defined. And that's important here. And I don't think it's what they're associated with directly that automatically gives them a pass. It's who they are and vetting these people and their experience, their bedside manner, being a human, first of all, to be honest, and the volume of ACLs that they do in a year, weekly, monthly, the graft types that they do and what they're experts at, the outcomes that they get if you're able to gather this information, but especially knowing what their testing process looks like. What does their protocol look like? Because every surgeon has a protocol. Their criteria for running or for getting cleared to go play sports again. What is their perspective on good rehab? Do they believe in good physical therapy? Some don't even care for it and don't believe in it. So you will get answers across the board. And while it may seem like you are trying to interrogate or interview this surgeon, these are things that are important because y'all, like, this is such a big procedure. So we don't need to worry about hurting their feelings or there's ego involved. And, we should just assume that they're the professional who is right for you, right? We still need to do our due diligence. And so that's just some side points I want to make here of what's important, because sometimes we almost let these accolades or these particular associations automatically put this person in the best category just because they're associated with this team or because they've done X person's surgery, right? And the thing that's interesting is that these ACLers, a lot of times, sometimes they'll travel out of state or they'll go hours and hours and hours away for the quote unquote best surgeon. They've done their due diligence. And don't get me wrong, sometimes this is the case and you do line up the best surgeon, which is awesome. And it's just such a breath of relief, if you will, whenever there is a good surgeon to work with. And there are a lot of them out there. There are also a lot of difficult ones to work with, locally here in Atlanta and also all around the world. And so if you found a good one, more power to you. And that is an important step. I'm not saying don't do that, but vetting them appropriately and making sure you do your due diligence with any member of this team is important. I would do the same. And I did do this for my hip. I didn't necessarily do that for my 2 ACLs because I was young and, I didn't have a lot of information available. I just kind of went to whoever heard what I did, and then I just went with it, right? But now that I know better, I try to make sure that we have the right people on our team. But then when I go to ask these same ACLers about their physical therapist, the practice, and where they go, there's less research. And it ends up being based on 2 factors more than anything. Number 1, what accepts their insurance? Number 2, what is the closest to work, school, home, / what is most convenient? There may be another part that plays into this, that is, what are their times they're open to schedule you? I know for high schoolers, sometimes they have to go after school. And if a PT clinic closes at 4 o'clock, that doesn't create a lot of time available. So often there will be offset PTs who will work at clinics, especially insurance-based or even out of network, that will, stay open until 6, 7 to be able to see these late high school athletes or people getting off work who can't make it in earlier, right? So then that really does influence the decisions, right? What accepts their insurance and typically convenience. And sadly, as if all physical therapists experience, their clinics, the rehab itself for ACL rehab is exactly the same across all physical therapists, but it's not. And I'm not saying everyone falls into this category, but this is very, very common from ACLers we talk to. And of course, I totally get it. People who are reaching out are probably people who are dealing with problems versus people who are like, I'm crushing it and I'm going to reach out to Robbie, right? It's not necessarily the case, but knowing the landscape of ACL rehab, the way our medical system is, the way insurance is, the way our physical therapy education is, and just knowing this process personally, but professionally, that this often happens. And especially as I had shared after talking with so many different ACLers through this process, there's always a common theme of seeking out the best surgeon or doing some homework there. And then whenever it comes to physical therapy, it ends up being a matter of those two factors of what's convenient and what insurance is going to basically cover, right? And for people who I'm talking to, they are typically in three main situations that many are in, going from worst to the best case scenario here. So I'm just going to list these. So the worst is a very bad surgeon and a very bad physical therapist. That is not a good situation to be in. Next worst case is a good surgeon and a bad physical therapist. This is to me the next worst. A better case is a bad surgeon and a good PT. And when I say bad, I mean, I recognize that I might be a little biased here again, but when I say bad, it means that they do just an average job. They're not the best. They're not the go-to that has been recommended. They get the graft, right? They put it in there and they have done their due diligence of what the procedure needs, but maybe they didn't have the best bedside manner. Maybe they didn't explain anything. Maybe it was just like a very average procedure, right? And so that's better in my personal opinion, and I'll share why, with a bad surgeon versus a good PT. And then the best case scenario, of course, is going to be the best surgeon and the best PT, which in this case, even with a very hard ACL rehab process, you're not going to be feeling lost. You're not going to be feeling directionless. You're not going to be lacking trust. So you're in a good spot because you've got the best surgeon. So you've created a really solid team with that surgeon, but also a very good physical therapist that you have sought out and are working with, right? So your GPS system is dialed in. You have this team to help guide you through this process. But more often than not, most ACLers are not in this best case scenario, given the way rehab education is. As I had shared, majority of physical therapists in outpatient orthopedics are not ACL experts, and most clinics are not designed to help ACLers get back to full sport and performance. And so my point here to share this is that these ACLers often do a lot of work to find the best surgeon, then settle for their physical therapy based on convenience. And again, not everyone, but this is just something that I consistently see. And this creates a difficult ACL rehab. The tough part about this is that they don't realize it until they're months in and after post-op, because even the worst PT can help someone post-op just by nature of how the initial post-op process can go and just the constraints or the limitations of it, right? You're more likely to see progress than not. You're likely to improve your pain from that baseline post-op because you're going to have that sharp pain that will eventually improve compared to the first day or two post-op. You're likely to improve some range of motion, even if it's to 40, 50 degrees, right? You're going to go from a straight knee to some bending, and then you're going to probably eventually get off of 2 crutches to 1 crutch to no crutch, right? And so you're going to see milestones in progress regardless of even generic rehab because of just the natural healing process and because of how limited you become post-op. And then you start to heal, you start to do some movement, and therefore you're going by nature going to improve in this process early on. But the thing is that it's hard to know how good you could improve because of the rehab you may be getting, right? And so that's how it can be really challenging, because it's not until in hindsight that maybe some of this can be noticed. And when I'm looking at the surgeon and the PT, right? And I'm not saying it is this one versus the other. It's like the goal here is to get the best of both, right? But I've seen in many situations, even for our team, where ACL surgeries haven't necessarily gone the best, or their surgeons aren't very helpful in the process. They do the surgery and then they kind of like brush their hands off and they're like, hey, I've done my job. Now it's the physical therapist's job, which is, it's easier for there to be failure on the physical therapist than there is for the surgeon, because really the things that we are dictating after an ACL surgery is going to be more the physical and functional abilities. And that's going to be more the physical therapist job than it is the surgeon, right? And so then therefore, when I look at this, I'm also thinking, okay, well, if I'm looking at the ACL rehab process, a lot of times I like to come back to some examples, especially referencing like building a home. And so this to me is like hiring an expert architect. You've done all the research, you found the best architect to design your dream home, and then just finding like a generic, cheap builder to build your home, right? You find the best designer, but then therefore you kind of went a little bit of a side route with the generic cheap builder. And then some other examples that come to mind is maybe the director, they're an amazing director, but then the editor is generic. An incredible financial planner, but your CPA is not really great. They're average. A brilliant branding expert, but then you're building a generic website, right? And in many of these cases, you could still get a good quality outcome if the second professional mentioned was incredibly skilled. But could you imagine the product if both were amazing, right? And usually for an amazing product and amazing outcome, the team in general is all around really good. It's very rare that one person's bad, one person's good, and they create an amazing product or an amazing service. And that's the point I'm getting at here, is to take the time to make sure your ACL team is quality and it is legit. Put as much, if not more, stock in your physical therapist and the coach you're working with. And I promise you, this person will make or break how your rehab goes. The surgeon would have to really botch the surgery, to be completely honest, in order for an incredible skilled PT to not be able to do their job in getting you back to what you would like to do. Guys, we've seen some not so great things from surgical procedures, and we can make it happen. And I'm not saying it's all that we can fix. There are certain times where we have to refer back to the surgeon because the knee doesn't heal properly. There's a cyclops, scar tissue, a tibial button or screw issue. People are dealing with things that just the body doesn't take to very well. And that's not necessarily the surgeon's fault. It's not the PT's fault. It is just the biological process of healing and that human, and it just didn't work out the way it did. So then, we got to refer him back. We got to get some help from the surgeon, and it might be that surgeon. It may be a different surgeon. But with that said, we can't fix everything, but I promise you a very average surgery with a very good physical therapist will very much influence a strong outcome for your ACL rehab. And it will give you more of a sigh of relief to know that you are guided by somebody through the day-to-day and they know what they're doing. And so that is something that I've been really trying to think about recently, because I've been getting some really challenging cases, even myself, of people with just not great surgical experiences, maybe very subpar experiences, some where maybe the technique is super old, right? And so then therefore, what do we do with this? How do you communicate this to the athlete? What do we do about the rehab process? And a lot of times what I find is that they're also just going to a very generic physical therapist. So then therefore they're getting the typical starter kit of quad sets, straight leg raises, 4-way hip, doing some air squats, maybe getting some lighter weights, doing some lunges, step ups, and then maybe they're doing an agility ladder and maybe some box jumps. And then they're progressing things based on time. There's no testing really. And the thing is that makes things just so challenging in this process, because it's just not the way that it should be done. And it needs to be done through criteria, through making sure that is individualized to you. And we can't give you the starter pack ACL rehab exercises that everyone is getting, right? And so one thing I've been trying to utilize is a rating scale for different things. And so I think that this is the perfect situation for it. So one way to look at this is if you had to rank your surgeon from 0 to 10 in terms of your overall experience, from their bedside manner, guidance, surgical outcomes so far, what would you rank them? And if it's not a 0, and if it's not a 10, why not? What do they need in order to hit a 10? Now do the same for your physical therapist, coach, whoever you're working with from a rehab standpoint. Go from 0 to 10. What would you rank them? And if it is not a 10, why not? More importantly, if it's not above a 7 or an 8, that's a red flag. especially for ACL rehab, y'all. I think that there should be a high level of expectation no matter the care that you are getting, but especially for something like this with such a high re-injury rate, with such a high risk of not getting back to what you want to do, long-term knee health, from maybe having to put off a total knee replacement to having it sooner because of osteoarthritis progression. All of these things matter, y'all. And so I think that if you are basically ranking yours less than an 8, that needs to change. And what I find is that many people would rank their surgeon high and their PT lower. Why is that? And then it comes back to the initial time taken to vet them and finding the right professional, or a matter of convenience. And don't get me wrong, like, I get it in most situations. Physical therapy comes after, while prehab is awesome. Hopefully you get in there, you can find the right PT before you have the surgery. What ends up happening a lot of times is that people don't get introduced to their physical therapist until after the surgery is done in most cases. And so then therefore, they just kind of like, all right, this is good enough. You know, they're a professional, they've had an education. And so then they just kind of go through it. And then once you're kind of in it, you're in it. So then therefore they don't want to just switch up midpoint. And it's also harder to figure out whether they're good or not whenever you're so early post-op, because that's the last thing you're worried about doing. So it takes time for that to develop for you to really be able to see that. And so if you feel like you're ranking your PT lower, I want you to define it. And of course, see if there's something that can be improved. And if not, then change it to where you can feel confident ranking it a 9 or a 10. You deserve the absolute best. And sometimes we just don't know what we don't know. And that's okay. And it's a direct result of, this being in hindsight that we learn it. And I think it's okay to have some space for that, because we don't know what we don't know, but once we do know better, we have to do better. And if we don't, the result is on us at that point. So if you feel like you find yourself in this situation, I really hope that you advocate for yourself and make the change now. I promise you, in the first 1 to 2 weeks, if you're with a very good professional ACL rehab expert, someone who just knows this stuff, you'll notice an immediate difference. You'll exhale knowing you've got a solid GPS and an expert team navigating you on your ACL journey. And the biggest thing I would say is, please just don't look back 3 months from now, 6 months from now, or heaven forbid, years out, wishing you would have done it differently, right? You only get one body, 2 knees. Give it your best shot now, not later, because you deserve really good care. And I fully believe that elite care shouldn't be just for pro or elite level athletes. Everyone deserves it no matter what level or status, and that is just good healthcare. So make sure each professional on your team isn't an expert and is quality, and just make sure that you vet them and make sure you do your due diligence. So instead of there being this pie where it feels like 70% of the weight and the effort of searching was more for the surgeon, and maybe 30% was for the PT. And I know in theory it could be a 50-50 thing here, but a lot of times what I see is that there tends to be a lot more heavy weight towards the surgeon side, and then we almost kind of settle a little bit for the PT side. And I know that this healthcare landscape, no matter what country you're in, is very challenging. So I'm not saying that this is just an easy pivot or change, because I know that there are a lot of things to navigate and jump through. But I do think at the end of the day, if we can evaluate, am I getting the best care possible? And if your answer is no, and you rank that 0 to 10 lower than you feel like you should, then that's when we need to evaluate and say, okay, what needs to change? Is it a conversation with the physical therapist? Is this conversation with a surgeon? Is it trying someone else out and seeing, is this a better fit? And maybe that person was good for where you were in the early post-op, but maybe after that first 6 weeks or 8 weeks, the value or expertise or their skill set diminishes, right? Everyone's kind of got their own area that they're really good with, and they're not going to be masters of the whole thing unless that is all that they do. That's all they focus on. That's all they see. Y'all, it's really important to just make sure that you get really good care. And I know I'm biased here, and you guys are probably like, wow, you're really beating a dead horse with this conversation. But I just continue to see this, and I just want to make sure that if you're listening to this and you're early, especially, or you're planning your next steps, that you're able to just get really good care, because I do believe that it can make the difference in the rest of your journey, but also just from how much this recovery takes a toll on you mentally. And when you don't have good guidance and good care, it just makes it worse. There's more anxiety, there's more fear, there's unknowns. And while some of that stuff exists, even with the best, I promise you that there's a difference in the perception of it and your direction and clarity around how you're going to get there. Because any good expert professional is going to share how that's going to look and to give you that plan and that roadmap. So please do that. Please evaluate it. I promise you it will be so worth it to be able to make that change. Even though it's uncomfortable, choosing that hard now versus the hard later will be totally worth it. And it's because you deserve care. And because of technology now, it's not like you have to go to this high-tech facility in order to get that. There are many different ways from a remote or in-person standpoint to be able to access really elite level care and expertise. So reach out if you need any help. There are tons of people out there who are also doing really great stuff. So make sure you make some moves if you feel like this is kind of pressed on you after listening to this episode. And if you have any questions, please reach out to us. Until next time, this is your host, Ravi Patel, signing off.